In today's episode, we are going over a physical therapist guide to improving patient sleep. Let's go. First and foremost, thank you so much for your support. You allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I love all things fitness. This is the Fitness Pain Free Show where we help coaches and physical therapists like you get your patients out of pain and back in the gym where they belong. If you're watching this on YouTube, please hit that like button, leave a comment, and subscribe to the channel. If you are listening to the podcast version of this, please leave me a great review. It really helps a lot. If you want to go that extra step and support me further, consider subscribing to Fitness Pain Free Insiders. It is a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for personal trainers and physical therapists. It's premium content updated by me. I've been doing this for the past 5 or so years. Has over 100 webinars, ebooks, and complete guides. Has access to a private Facebook group. So if you want to have any questions answered by me, you have access to me. You can decide upcoming podcast topics. You can start for just $1, super duper cheap. After that, it's just $12.99 per month, and it really helps me a ton. If you want to go that next step in learning from me, this is definitely it. So, if you want to learn more, head to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders Online Library. I'll also put a link in the show notes, so go ahead and get started. So first and foremost, why should physical therapists care about sleep, right? We tend to care about pain. We can tend to care about injury. Why is sleep relevant? Well, for a lot of reasons, actually. So what's interesting is that sleep correlates with the onset of pain and the onset of injury. So poor sleep is going to increase your risk of getting a new injury. It's also going to increase your risk of the onset of a new type of pain or flare up of a pre-existing type of pain. Okay. It also has a big influence on your ability to recover from an injury. So poor sleep increases your risk of pain becoming chronic. In other words, if you get an injury, there's always a chance that that injury can become chronic over the course of time, but not getting enough sleep is going to increase that risk. And the other piece is that having good sleep is going to improve your long-term prognosis. So if you get good sleep after you have an injury, it's more likely you'll do well in the future to get rid of that injury, right, and feel better. The other piece is that sleep correlates pretty tightly with performance, okay? So poor sleep is going to reduce your performance, and then good sleep is going to improve your performance. And we'll talk about this a little bit later, but as physical therapists, we're not just thinking about pain. We're also thinking about strength and endurance. And a lot of these factors are going to be super relevant to sleep, because if we sleep better, it improves all of those things. Improving sleep can also be improved with a few simple tips, and improving sleep is going to improve your pain, all right? So as physical therapists who are working with folks who have pain, we can improve people's sleep by giving them good tips, and then improving that sleep is going to subsequently reduce pain, improve your injury. So you can see why it's super relevant to think about this as a PT. So does sleep increase your risk of injury or having pain at some point in the future? So there's a bunch of research on this, right? One of the papers I really like, and all the research papers are going to be in the show notes, so you can definitely check those out. But in university athletes as well as youth athletes, reduced sleep is going to increase your risk of injury. In a general population, reduced sleep quality and or quantity, or having multiple sleep disturbances, which is also kind of a sleep quality thing. This is associated with a 2 to 3-fold increase in the risk of developing a pain condition, small elevations in levels of inflammatory markers, and reduced sleep quality is also going to increase the risk for new onset cases of chronic pain in pain-free individuals, right? So chronic pain is one of those things where you get injury and things just don't seem to get better over the course of time. If you're not sleeping well, you're more likely to end up getting this, right? As a physical therapist, I really want to make sure that my patients are getting adequate sleep so you don't end up in chronic pain, okay? We want that pain to go away over the course of time. And there's one research study in women that showed that frequent sleep problems, which is defined as frequent difficulty falling asleep or having a sleep disorder, significantly increases your risk of developing fibromyalgia 10 years later, okay? What's interesting is if you're looking at some of this sleep literature and pain, a lot of this is in chronic pain as well as fibromyalgia, right? There's not as much research in young athletic folks, although there's more and more of this research starting to pop up. And it seems like in general, most folks, regardless of whether or not you're an athlete or you're a chronic pain patient or you're a geriatric or you're somewhere in between, it's important for everyone. And it's important for everyone for pain and injury as well. So does sleep influence your ability to recover from an injury? Well, yes. So, sleep disturbances may impair recovery from chronic pain. And this is thought to happen by reducing endogenous pain inhibition, right? So, if your body is not good at inhibiting pain, you're more likely to experience pain. So, if you sleep better, it might make you a little more resilient and less sensitive. Okay. Insomnia increases the risk of exacerbating existing headache and developing new instant headache at long term follow up. Okay. So, if you don't sleep really well, this is going to give you more headache issues if you're prone to them. Sleep disruption linearly predicts next day pain reports in patients. So basically, if you sleep really poorly one night, the next day you're more likely to experience pain, and vice versa. If you sleep really well, then the following day you're less likely to have as much pain. Okay, so your pain is going to change day to day based on the amount of sleep you've had. And also, poor sleep is going to worsen the long term prognosis of existing chronic musculoskeletal pain. So, if you're trying to get out of pain, right, it's been going on for a long period of time, so it's chronic. If you're not sleeping well, your prognosis is a little worse than if you sleep a bit better. Good sleep appears to improve the long term prognosis of individuals with tension type headaches, migraines, and chronic musculoskeletal pain. Patients with both chronic pain and sleep disturbances have greater pain severity, longer duration of pain, greater disability, and are less physically active than those without sleep disturbances. Okay. So, obviously, those are really big issues from a physical therapy perspective, but you're starting to find that folks that have poor sleep, it's not just pain that they end up having trouble with. There's a lot of different things. Quality of life definitely goes down. And we'll talk about what happens to your health with a lack of sleep a little bit later. Patients with pain and poor sleep are more likely to have concurrent depression, catastrophizing, anxiety, and suicidal ideation. Now, those things together should definitely raise a flag in your mind, right? They're all really bad. I think we can all agree upon this, right? Those are also very important psychosocial considerations in rehabilitation. So, one of the ways you might be able to address some of these issues might be with better sleep, right? So, how does sleep affect your performance? We're talking about performance more from a sporting perspective, right? So, poor sleep is going to decrease run performance, decrease muscle glycogen concentration. So, basically, after you exercise, your body is depleted of glycogen or stored sugar within your body, right? And if you're not sleeping well, your body has a harder time of restoring this glycogen. You may have reduced strength. In some studies, this was the bench press, leg press, and deadlift. Obviously, big lifts that we're oftentimes trying to improve. If you're listening to my podcast, I love the strength and fitness world. I'm talking about powerlifters, Olympic weightlifters. Sleep is going to be important for you guys, right? Isokinetic peak torque gets worse with less sleep. Minute ventilation gets worse. Distance covered in endurance tests also gets worse. Sprint times get worse. Your tennis serve accuracy, as well as soccer kicking skills, worsen. You have poor results on time to exhaustion tests. And, going over all of these performance measures, right? So I noted this prior, but strength being one of these very obvious ones, but also endurance, right? We're oftentimes trying to get patients better, and we know their strength and their endurance is going to be related to the goals we may have from a rehab perspective. So if patients aren't simply sleeping well, it's going to affect their performance, but it's also going to affect that rehabilitation. Okay. So it's of the utmost importance for our patients. Poor sleep is also going to reduce your cognitive function. And this is going to be your judgment. It's also going to be decision making. And it also is going to decrease your mood, right? Anyone who slept poorly, will know that your mood often goes down with reduced sleep. Okay. And what's important to understand too is that we have some good research to show that reduced mood, which is also a reflection of how much stress you have. So we're muddying the waters in terms of what mood actually is. But poor mood is going to also correlate with risk of injury. Okay. So if your mood is getting worse, your risk of injury is also potentially getting worse. We know if you don't sleep well, you're often more at risk for injury, right? Not good. And the opposite is true. So if you increase the amount of sleep you have, so these are in sleep extension studies, so they'll add sleep to someone's regular routine, it positively affects reaction times, mood, sprint times, tennis serve accuracy, swim turns, kick stroke efficiency, and increase free throw and 3-point accuracy. Okay. So, from a sporting perspective, getting more sleep is obviously going to be good for you. So, how does sleep affect your health? Inadequate sleep duration and or deprivation in the general population is associated with a myriad of negative health effects. And I'm just going to list these out for you. So it's associated with obesity and diabetes, neurocognitive, immunologic, and cardiovascular dysfunction. It negatively affects growth hormone and cortisol secretion. We'll talk about cortisol in a bit and why this is really important for sleep. It's going to increase pro-inflammatory cytokines, which impairs immune system function, impedes muscle recovery and repair from damage. So inflammation is important for a lot of different things in your body, positively and negatively. Sleep is going to influence that. It can lead to autonomic nervous system imbalances, basically simulating overtraining symptoms. It alters pain perception. We talked about this before, but if I sleep poorly one night, the next day, I'm probably going to be a little bit more sensitive to pain, right? More sensitive to my body creating a bit more pain, okay? More central sensitivity potentially. And if I don't sleep well, I'm more likely to have depression, catastrophizing, anxiety, and suicidal ideation, right? And if you haven't seen this before, in a lot of our medical literature, catastrophizing is something that's going to correlate with folks that have pain. It's also one of those things that we believe will extend the duration of symptoms in folks that do have pain. So some of these negative beliefs are associated with a lack of sleep. And potentially, if we improve our sleep, it's going to help with those as well. So obviously, from a health perspective, we got to get more sleep, but it's also super relevant for physical therapists because we're trying to prevent injury. We're also trying to get people back into whatever activity they were doing previously, okay? Keep them healthy for the long term. So the next question naturally becomes, can we improve our patients' sleep? Well, yes, we definitely can. Healthy sleep can be trained and improved upon by utilizing regular routines and creating an optimal environment for sleep, right? And we do this through something called sleep hygiene, which we'll go over in depth in a bit. Including a simple sleep hygiene / sleep optimization education program for athletes has been shown to improve sleep time and efficiency, which is important because if we tell someone that sleep is important and we show them how to get better sleep, does that actually improve their sleep? And yes, it does. It seems like if we give people the advice, we give them sleep hygiene ideas, and they obviously have to go through with them and utilize them, which it seems like most folks end up doing that if we tell them to. It seems to improve sleep time and sleep efficiency. So great. That's very important. Okay. It means if we try to improve someone's sleep, probably going to be helpful for most folks. It also is able to reduce pain in patients with fibromyalgia and chronic pain. Now, this is really interesting because we can reduce someone's pain simply by improving their sleep, by giving them some tips about how to improve their sleep. Okay. And here's the other thing. There's a bunch of ways to improve your sleep. So some of which are drugs, as well as cognitive behavioral therapy for insomnia. That actually popped up quite a bit when I was doing a literature review about sleep and pain. So I think the bottom line is, as a physical therapist, there's probably only so much that we're able to do. And if someone really needs extra help with their sleep, you need to refer them out to a specialist. It's not like sleep hygiene is the only thing we can do to improve sleep. And we should refer people out to the professionals that specialize in this. So how much sleep is optimal? Now, if you're watching this on YouTube, you'll be able to see the chart right in front of you. But if you're listening to this on the podcast, I apologize. I'm going to try to read this out to you as best as I can. But suffice to say, sleep is going to be required at different amounts throughout the course of your lifespan. Okay. And I'm taking these recommendations from the National Sleep Foundation, from sleepfoundation.org. It's actually quite a good website about sleep education. But when you are a newborn, so basically 0 to 3 months, you're going to need on average somewhere between 14 and 17 hours per night of sleep. If you're an infant, so 4 to 11 months, you're going to need somewhere between 12 and 15 hours of sleep per night. As a toddler, this is 1 to 2 years or so, you need somewhere between 11 and 14 hours of sleep per night. In preschool, basically around 3 to 5 years old, you're going to need somewhere between 10 and 13 hours of sleep per night. If you're school age, so somewhere between 6 and 13 years old, you need somewhere between 9 and 11 hours of sleep per night. As a teen, from 14 to 17 years old, you're going to need somewhere between 8 and 10 hours of sleep. If you are a young adult, and that's going to be somewhere between 18 and 25 years old, you need somewhere between 7 and 9 hours of sleep per night. You need the same amount if you're an adult, so anywhere under the age of 65, and that's basically 25 to 65, you need somewhere between 7 and 9 hours of sleep per night. And lastly, as an older adult over the age of 65, that number maybe drops slightly to around 7 to 8 hours of sleep per night. So in general, early on in your life, you need more sleep. And as you get older, you need a little bit less. What you'll notice is that we never need less than about 7 hours, right? And I also give you averages just because everyone's going to be a little bit different in terms of their own needs. Some people are going to need a little bit closer to that 9 hour mark. Maybe other people do really well around 7 hours of sleep. One thing I will say is that if you have more stress in your life, if you're trying to get better from a sporting perspective, getting a little bit more is probably beneficial. We have a little bit of research to support that. So for athletes, maybe you need to add a little bit more sleep. Maybe they need to be closer to that 9 hour mark, whereas the average person is going to be a little bit less. Also, keep in mind that when you have less sleep, generally speaking, you do worse on tests of cognition, right, and memory. But the problem is that you can't perceive that you're actually worse. So, in a lot of folks, they may think they're doing fine at 7 hours, but they really don't know that. And if they got closer to 9, then maybe they do a little bit better. So, I just encourage you to see how well you do, as well as your patients do. If you just bump up the amount of sleep over the course of time, you may get more and more benefit, right? There's also the opposite side. If you sleep too much, that can be a problem too. So it's a double-edged sword in that regard. So just be smart. We're trying to find the right dosage, which is probably a little different for every single person. Next, I want to talk a little bit about sleep quality because it's not just sleep duration that's very important. It's the quality of those hours that is equally as important. So I'm not going to get super in depth into this. If you guys want to learn more, I highly recommend checking out Why We Sleep by Matthew Walker. It'll give you a very in-depth idea of these sleep stages, right? And which stages are important for what. So basically, as you sleep, you go through stages of sleep and you cycle through these stages multiple times each night. And each stage has an important function, right? So, some of the recovery that comes with sleep only occurs during certain stages and also towards the very end stages of sleep. Okay. And how fast you get into these stages as soon as you fall asleep is going to be dependent on a variety of different things, right? So, if you have exposure to a lot of light prior to sleep, if you exercise a lot right before sleep, if you ate certain types of food or too much food prior to sleep, if you sleep in a very hot room and are uncomfortable, right? You're going to screw up your sleep stages. Okay. And a lot of this has to do with two compounds, one cortisol and one melatonin. So basically, in the morning, when you wake up, you want to have high cortisol levels. Cortisol is going to be something that wakes you up. All right. Throughout the course of the day, you actually want your cortisol levels to go down slowly. And then right before you go to sleep at night, they should be very low. Okay. Melatonin is the opposite. When you wake up first thing in the morning, you don't want much of this. And over the course of the day, melatonin should go up, 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 up until right before you go to sleep. Okay. And having that cortisol level increase is going to be very important for getting good sleep from the get go. So as soon as you fall asleep, if you have high melatonin levels, these stages kick off naturally and they do quite well, right? The problem is if you have too high a level of cortisol and not enough melatonin, that when you fall asleep, you don't kick off the stages at the right time. Okay. So if you're sleeping for 8 hours, but you start your sleep poorly, basically you have not enough melatonin. So you have to wait for your body to produce a little bit more to start kicking off those stages. You might not get all of the stages in as much quality sleep as you would if you had your melatonin naturally high right before bed and cortisol low. Okay. So again, this is, I'm really simplifying this process. Go check out Matt Walker's book if you want this in depth. But the problem is if we make the wrong decisions throughout the course of the day, especially as we get pretty close to the evening, that's going to mess up our quality for the rest of our life, or excuse me, for the rest of the night. We're not getting all the benefits we normally would. Okay. And the other piece is if you're having frequent nighttime sleep interruptions, right? So maybe you leave the TV on, which we know with some research that we have a tendency to wake up a few times throughout the course of the night. It reduces sleep quality, or maybe you drink a bunch of alcohol. It does the same. So it reduces our sleep quality throughout the course for night. We don't want that. Okay. So sleep duration, very, very important, as well as sleep quality. So how do we improve the sleep of our patients? Well, we want to improve what's called their sleep hygiene, right? And sleep hygiene are basically strategies to improve sleep duration and sleep quality, okay? And again, there are other strategies that exist to improve your sleep. So if you're dealing with someone that really needs extra help, just refer them out, okay? What's kind of cool about sleep hygiene is this can be assessed. And this is important because if you have someone that comes through the door, right, they may actually sleep quite well, right? And they might sleep poorly. But we have to have some sort of assessment to figure out what their sleep hygiene's like and what their sleep is like in general. And this sleep hygiene index is something that we can use to see how good these folks are with their sleep hygiene. And what's kind of cool, it's actually been validated in chronic pain populations. So not only is it good to assess your sleep hygiene, but it's also good to assess sleep hygiene with the patients that we're working with, right? People in pain, right? And lastly, we just have to make sure that hygiene is actually the problem. Okay. We're not sleep experts. We need to refer out. Maybe someone has something like sleep apnea or something on those lines where we need to refer out to make sure that they're getting accurate diagnosis and not trying to hammer sleep hygiene down their throat. Okay. But I want to go through this sleep hygiene index because it gives you an idea of what we're looking for in our patients to see what we can improve, right? So basically, you give your patients this sleep hygiene index, you put your name, the date on there, and it says, please rate all the following statements using the scale below. 5, always. 4, frequently. 3, sometimes. 2, rarely. 1, never. The first situation, I take daytime naps lasting 2 or more hours. Number 2, I go to bed at different times from day to day. Number 3, I get out of bed at different times from day to day. Number 4, I exercise to the point of sweating within 1 hour of bedtime. Number 5, I stay in bed longer than I should 2 or 3 times a week. Number 6, I use alcohol, tobacco, or caffeine within 4 hours of going to bed or after going to bed. Number 7, I do something that may wake me up before bedtime. For example, playing video games, using the internet, or cleaning. Number 8, I go to bed feeling stressed, angry, upset, or nervous. Number 9, I use my bed for things other than sleeping or sex. For example, watching television, reading, eating, or studying. You basically want to make sure that your bedroom is used for sleeping and that's it. Okay. Number 10, I sleep on an uncomfortable bed. Example, poor mattress or pillow, too much or not enough blankets, right? We know that having an optimal temperature is important for sleep. Number 12, I do important work before bedtime. For example, paying the bills, scheduling, or studying. Number 13, I think, plan, or worry when I'm in bed, right? You basically have a total score after all this, and higher scores are indicative of more maladaptive sleep hygiene status. So if someone's scoring really poorly here, it's a good sign that there's a lot of stuff we can do to help this individual out, right? There's a lot of potential to improve. So here's some sleep hygiene recommendations. Now, these are taken from Vitale et al., IGSBT in 2019. They're also from the UCSD Center for Pulmonary and Sleep Medicine patient information handout. So this is an evidence-based tool, all right? Want to make sure that you're giving patients evidence-based tools whenever you can. So I'm going to read these out to you. Number 1, don't go to bed until you are sleepy. If you aren't sleepy, get out of bed and do something until you become sleepy, then go back to bed. All right. Number 2, regular bedtime routines and or rituals help you to relax and prepare your body for bed. So that's going to mean something like reading, warm bath, something relaxing. If you're doing something intense before bed, despite that being a ritual, it's not a good one, right? Number 3, try to get up at the same time every morning. That is including weekends and holidays. I think that's very challenging, especially for young folks, people that party on the weekends. It's going to be very challenging for those folks to go to sleep the same exact time on the weekends, but it's going to be important to do that, right? Number 4, try to get a full night's sleep every night and avoid naps during the day if possible. If you must nap, limit to 1 hour and avoid a nap after 3 p.m. The reason for that is that if you take naps throughout the course of the day, that can actually make it more challenging to fall asleep at nighttime and reduce the quality of sleep when you fall asleep. Okay. So generally speaking, we want to get all of our sleep at nighttime. Naps can be beneficial, right? But the problem with naps is that they're probably not as good as just getting enough sleep at nighttime. All right. Number 5, use the bed for sleep and intimacy only, not for any other activities such as TV, computer, or phone use, etc. This one's very challenging, but generally speaking, you want to train your body to only use your bedroom for sleep and nothing else, right? Number 6, avoid caffeine if possible. If you must use caffeine, avoid after lunch, right? So in that sleep hygiene handout, said anytime 4 hours before you go to sleep at nighttime. Some folks, including myself, are better at metabolizing caffeine. So if I drink caffeine around 2 to 4 p.m., I have no problem whatsoever going to sleep, but some folks, they do that, they have a lot of trouble, right? So if you metabolize caffeine a little bit faster, then maybe it's okay for you to drink closer to bedtime. But generally speaking, try not to have caffeine in the afternoon. Okay. Number 7, avoid alcohol if possible. If you must use alcohol, avoid right before bed, right? Seems counterintuitive because for a lot of folks, drinking a glass of wine helps them go to sleep at night. The problem with that is that when alcohol is metabolized in your body, it actually wakes you up a little bit. So if you drink alcohol, it may help you go to sleep, but it's going to reduce your sleep quality. Number 8, do not smoke cigarettes or use nicotine ever, right? Nicotine is a stimulant and cigarettes are just dang bad for you. So that makes sense. We don't want to use those. Number 9, consider avoiding high intensity exercise right before bed. Extremely intense exercise may raise cortisol, and that's going to impair sleep. Like I said before, as we get close to sleep, we're trying to wind down, not rock it up. Okay. We want to make sure the cortisol levels are low and melatonin starts going up. Okay. Number 10, make sure your bedroom is quiet, as dark as possible, and a little on the cool side rather than on the warm side. Okay. So think similar to a cave, nice and dark. I use blinds to block out all the light. I think that's super helpful. I also use an eye mask. Eye mask is very, very useful when you're traveling. Okay. Because you don't know what kind of drapes or blinds you're going to get wherever you go to. If you have an eye mask, doesn't matter. Okay. In terms of where your temperature should be, I did find a research study, and you can take a look at the show notes if you want to see this, but they're recommending a cool, dark room, somewhere between 19 and 21 degrees Celsius. That's 66 to 70 degrees Fahrenheit. Okay. If you like to use a lot of blankets, then maybe you want it a little bit colder. If you're okay with just a sheet or no sheet whatsoever, then maybe you can have it on the warmer side. Okay. And again, there's probably going to be a bit of personal preference there. But if you're finding that it's too hot for you to go to sleep, take the temperature down, vice versa, too cold, turn it up. Okay. Makes sense. Here's some other tips and tricks for healthy sleep hygiene. Number 1, avoid blue light emitted from screens at least 2 hours before bedtime. Okay, that's tough, but this means all smartphones, laptops, and monitors in general. Blue light suppresses melatonin production that is needed to induce sleep. So avoid text messaging, social media, games, and app use. Okay, and this is obviously very difficult, but it's going to be important. I like to use blue light filtering glasses, which research has shown will increase the amount of melatonin at nighttime if you wear it, right? There are also different apps on phones, on the laptop, like Flux you can use to reduce that amount of blue light. So hopefully if you need to use a computer at nighttime, you don't have the blue light, which is going to raise your cortisol and reduce melatonin. Okay. Number 2, get bright natural light from the sun upon waking. So the sun is ideal here, but some suggest at least a 10,000 lux lamp if you're getting artificial light. So one of the things I do in the morning is I go for a walk with my son, Luke. It's only about 10 or 15 minutes, but I get bright light directly into my eyes. I don't wear glasses. Okay. And I think this serves 2 purposes. So for one, exercise is good. Time with your son, good, right? A lot of positives there, but I'm getting the direct sun in the morning, right? Because I want that direct sun to increase cortisol levels. I want my brain to know the sun is up. I got to get going. All right. And the other piece is that if you're exercising, that's also a bit of a stimulant. So you're raising cortisol a bit just because you're exercising. Okay. So 2 birds with 1 stone. Get out early in the morning, help to set that circadian rhythm. So over the course of time, we have high cortisol in the morning, low in the evening, and melatonin does the flip, low in the morning, high at nighttime. Okay. That's what we're looking for. Number 3, don't hit the snooze button. It does not improve sleep quality, contrary to what my wife believes. Number 4, if you have difficulty waking up, some suggest a dawn simulator alarm clock, right? And I actually have never used one of these before, but the idea is that as you're approaching your wake up time, the alarm clock will slowly wake you up. Okay. And this could be in the form of noise or vibration, or the lights turning on slowly over the course of time. So basically, we're trying to avoid a sharp, aggressive wake. So it's basically slowly waking you up out of that last sleep stage as opposed to hitting you with a hammer and just screaming at you, right? Number 5, if you must use your computer at night, consider installing color adjusting and blue light reducing software or wear blue light blocking glasses. And we kind of discussed this previously. Number 6, meditation may be helpful. Brainwave entrainment, example, binaural beats, is considered experimental. I personally don't know anything about that. What I will say is that meditation can be nice and relaxing. It's a good way to try to calm yourself down at the end of the night. So definitely worth a shot. Number 7, Higher carbohydrate, namely high glycemic index foods at night, may improve sleep, as well as high protein, including tryptophan. High fat intake at night may disrupt sleep. Inadequate total caloric intake during the day may impair sleep at night as well, right? So I don't know if it's a great idea to just pound a ton of sugar, right before you go to sleep at nighttime, just for the health effects. But I imagine it might have to do something with the blood sugar response. So you probably have a rush of blood sugar, and then you have a crash, and that maybe makes you feel like you have to go to sleep at nighttime. What I will say is it's probably not a healthy habit, but maybe it's something you can try at nighttime if you're really having trouble getting to sleep and nothing else has worked. Okay, number 8, topical magnesium or oral magnesium. So think about a salt bath or a topical mineral oil or just a supplement. May help if you are deficient, right? A lot of people are. Magnesium is one of those nutrients that most folks are deficient in. Number 9, melatonin naturally occurring in foods is a good idea. So tart cherry juice, raspberries, goji berries, walnuts, almonds, tomatoes may potentially improve sleep, but avoid artificial melatonin supplements. I'm not exactly sure what they're basing their research on melatonin here, but suffice to say, from what I've read in the past, melatonin is helpful for jet lag if you are crossing time zones, but otherwise not particularly helpful for the average person trying to go to sleep at nighttime. Number 10, don't fall asleep to the TV. Sleep studies show you frequently wake up during the night and have poor sleep quality. I know a lot of folks like that TV to help lull you to sleep. But the other piece is that they may actually wake you up throughout the course of the night. It might not be a good thing, right? Number 11, herbal supplements are largely unknown with potential serious side effects and may be on USADA prohibited lists or result in positive banned substances tests for athletes. Now, this study was in IJSBT, which caters towards athletes, and this study was actually for athletes. So they're thinking about the supplement in terms of if they're getting drug tested, you may eventually get popped for PEDs. And the other piece is that, I agree. A lot of these supplements, we're not sure what the side effects are, right? Or we know there are side effects and people kind of take them anyway. So just want to be safe. Obviously, before you take any supplement, just chat with your doc, okay? Make sure that it's okay for you, okay? Number 12, consider reducing your fluid intake before bed so you don't get up to go to the bathroom, and only if you maintain enough hydration during the day. So if you don't sleep at all throughout the course of the day, you probably need to drink a little bit at least at nighttime. Okay. It's better to be waking up once in the middle of the night to go pee than to be chronically dehydrated. But generally speaking, try to get your fluids a little bit earlier in the day so you don't have to wake up 3, 4, or 5 times at nighttime to go pee. Obviously, that's not good for your sleep quality. Number 13, cooling your body temperature may improve sleep. Some suggest keeping room between 60 and 70 degrees. However, keep hands and feet warm. So use socks and gloves during winter months if you need to. Okay. As I said before, having enough coolness in your room is important for sleep. If you overdo it with coolness, that can be a problem. And if it's too hot, that's also a problem. So find a happy medium that works well for you and go for that. Okay. Number 14, check your mattress. It may be too old. So mattresses typically last at maximum of 9 to 10 years and may have allergens. So I really wasn't thinking about this, but if you have an old mattress, maybe you're allergic to it. Maybe that's creating some difficulty sleeping and you need a new mattress. Okay. And lastly, number 15, recovery from exercise should not only focus on muscle recovery, reducing mental fatigue is just as important for healthy sleep. Reduce external stressors in your life. And having a little less stress in your life is probably going to help in a variety of ways. But if you're that type of person that burns the candle on both ends, that's definitely not helping with your ability to sleep at nighttime. So I know this is a tall order, but see if you can reduce some of that stress within your life. It's probably going to improve your sleep too. So how do you improve sleep hygiene with patients? Well, one, first and foremost, you have to assess if it's actually an issue in the first place. And I talked about this before, but you can give your patients an outcome measure and they can fill it out and you can very easily see, okay, this person has terrible sleep hygiene, or okay, this person is doing extremely well. I got to be honest, this is something that I want to make a little bit more systematic in my own practice. I currently don't have a really good way of assessing this. I try to kind of tease this out in my subjective, but we'll find from person to person, I'm maybe not as thorough as I could be, right? So you can ask a few questions about sleep in the subjective. It's actually quite simple. So you can say something along the lines of, do you have trouble sleeping? How many hours of sleep do you get per night? How often do you wake up during the night? 1 or 2 times per night is normal. If they're waking up 3, 4, 5 times, then that's not great. And most folks will tell you if they have trouble with their sleep, it's pretty easy for them to know that. And if they're having a pain problem, it might be something that's contributing to that. Okay. And lastly, if you're unsure or you just want to be very systematic, just give people the questionnaire, and it's super easy to tease out all of these little variables. Because do keep in mind, some folks may have terrible sleep hygiene, okay, and not realize it. They may think they're doing everything perfect, right? So if you ask them, how you doing with your sleep? They may say, I am doing phenomenal. I have no trouble with my sleep, right? But in reality, maybe they're on their phone all night for 3, 4 hours right before they go to sleep. They do all of their work right before they go to sleep. They go to sleep with the TV on, right? And they wake up multiple times per night to check their social media, right? But they think that's good. So it's just important that you understand that patients may think they're doing well and they might really not be. Okay. Now, this is a very natural segue. If someone says they're having trouble with sleep, or you give them the questionnaire and they're doing poorly, you can just educate them on the importance of sleep, right? And I think most folks, when they come to a physical therapy facility, they're not looking for a lecture on sleep. So you have to be a little careful with what you end up telling them. But I think it's very important that we educate our patients that there's a pretty strong link between pain and a lack of sleep, right? We don't necessarily know if it's a chicken or the egg thing, right? Does a lack of sleep lead to pain? Does pain lead to a lack of sleep? It seems like they are correlated. In a lot of ways, it does seem like having decreased sleep leads to pain problems. And if you have pain, it's going to be harder to get out of pain if you don't sleep well. So it probably does affect both ways. And if we want to optimize our patient outcomes, we probably want to talk about this, right? The patient should know about this. Okay. Just also keep in mind, and we just noted this, but oftentimes when a patient comes into you with a pain problem, they're not going to be thinking about their sleep, and they have other needs that they want you to address. Okay, so it's going to be important that you tell them about sleep as an issue if they're getting poor sleep, but make sure you just cover all of the needs that person has. I find that a lot of kind of new grads or people get really excited about sleep. They start talking about sleep for 15 or 20 minutes during the evaluation. And then meanwhile, the patient's like, what the heck is this guy talking about? Like, it doesn't matter to me. I'm not seeing the benefit of that. So just make sure you're meeting that person's needs. And eventually, when that person now trusts you and you built that rapport, maybe you start talking about sleep then as being a potential thing that's going to help them out. Right. I also tend to talk about sleep, and I kind of glom it all together with stress and nutrition and just recovery in general. Right. It makes sense. So sleep is one of those things that helps you recover from day to day. If you have a ton of stress in your life, okay, if you're not eating well, if you're not eating enough calories specifically, not enough protein, not enough calcium or vitamin D as it relates to maybe bone stress injuries, you're not going to be able to recover as well between bouts. Maybe you can't recover well from an injury. So we try to get a nice holistic approach going, and sleep kind of gets glommed into the stress and nutrition talk a little bit, at least for me. And that's my own personal style of how I deliver this information to patients. The other thing I think is very important is that we try to individualize a plan for improvement, right? So basically, we have our list of sleep hygiene, and we want to make sure we improve the aspects that are limited. So if you have a patient take the sleep hygiene index and you find that certain things are limited, then you probably want to make sure we focus on those specifically. All right. Now, this piece of advice came from Adrian Lowe, and he's a big pain science guy. He wrote a lot on therapeutic neuroscience education, did a lot of research on therapeutic neuroscience education. A very smart guy. And his advice for patients is to try to pick just one or two things to change over the course of time. So maybe that's just, okay, let's put you on some blue light filtering glasses at nighttime, and let's get some nice um, eye mask so you can wear that at nighttime, reduce some of the light, the ambient light that's in your room, right? Maybe those are the first two things that you end up changing with your patient. And then after they've gotten that down, we pick another two things to work on. And over the course of time, we slowly get better at sleeping, right? What I will say is that some folks like to make changes all at once, right? So a person like me, and I'm not the average person, I wouldn't say, I kind of like that whole list. I like to look at it and like to try to just go for it and change everything, right? And I know a lot of patients that are like that. They just want everything. They want to make all the changes. They want to optimize everything, right? So you get an idea of the type of patient that you're working with, and you give them the intervention you think that works best. Okay. You can always ask them, say, hey, do you want to try to change one or two of these? You want to try to change all of these? What do you think is reasonable for you? And you just come up with a plan that kind of works with the patient, right? So the other piece that you want to try to check in over the course of time. So if you tell someone like, hey, how are you doing with your sleep? Are you able to get to sleep at the same time every single night? And they're like, well, I'm having some trouble. And then you ask about why, and maybe figure out a new plan as to how we can improve that piece and just keep on pushing over the course of time. At the end of the day, it's very hard to make behavioral changes, right? And that's what we're doing, because people know if they're trying to lose weight, they should eat less food and probably eat more vegetables, right? But it's hard to do that. Same thing goes with sleep. A lot of folks are addicted to whatever it is that keeps them from sleeping at nighttime. Trying to break that habit is extremely hard. So just do your best to try to improve that. But the other thing is that a lot of this may be beyond our scope as physical therapists. So if you have someone who really needs help with sleeping beyond your abilities, then just refer out to someone who specializes in sleep, right? Like I said previously, I found quite a bit of research on cognitive behavioral therapy, or CBT for short, to improve insomnia, which also helps with pain. If you don't know how to do that, right, you should refer out to someone who does. That can be very helpful. There's also a lot of drug treatments that can be helpful for sleep. Obviously, that's not what we do as physical therapists. So don't be afraid to refer out for some of those patients that you think need it. All right. If you guys are interested in the references, I will leave those in the show notes. I'd love to hear what your thoughts are on some of these references. The learning is not over. If you are enjoying this video so far, your next step is going to be to click on this link that I am pointing to right here. It's going to be somewhere. So if you're watching this on YouTube, you'll see the video. If you aren't watching this on YouTube, I apologize. That's all right. We are wrapping up anyway. Thank you, thank you, thank you so much for your support. Again, if you're watching this on YouTube, give me a thumbs up, comment, and subscribe. If you're listening to the podcast version of this, give me a positive rating and review. It helps me out a ton. If you want to get that next step of learning from me, head over to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders Online Library. It's a $1 trial, a ton of value, super cheap. You get more great learning. Thanks again, guys, and I'll see you on the next one.